Let's see whether we can get some answers on autism. I'm sure there's some very specialized treatment which, maybe may or may not be part of your practice. I'm not really sure. But I'm sure that parents have the questions. What are the indicators? When do I think my kid has it? What can I do? What tests do I need to take? Can you tell us about that?
Right. One of the areas that we also specialize in the office is doing developmental checking. My partner and I, Dr. Lionel Herrera, who is very active actually in the school district, coming up with recommendations and working with a speech pathologist and School of Imagination in our area to help freely screen children. So we're very much into screening kids to see who needs any help. So autism is a disorder where children have very minimum amount of speech and social interaction. They a lot of times are involved with repetitive motions, and they have the inability to socialize. There are different degrees of it, of course. Some people have the very mild case, just a little bit of a socialization problem, of course, and then there's a severe case of autism that need a lot of help with their even daily activities. So we try to get, again, ahead of the game by doing developmental screening as early as 15 months to 18 months of age. Again, at the well visits, this is another thing that we do at each and every well visit is ask whether the child is developing well and reaching their milestones. But specifically for autism, the testing is done at 18 months of age and 2 years of age, where we specifically ask questions that has to do with speech and socialization. It is a little harder to pick up autism because these kids look the same much earlier in life, because we have to wait for the speech and socialization ability and development milestone to be reached. And that usually is reached between 15 to 18 months. That would be the earliest at the moment we're able to identify those kids that are not reaching their milestones. And the treatment for them is the early intervention, getting them to speech therapy early, not letting them fall behind, letting them to do some occupational therapy, to learn things that they would not otherwise learn. And it's been shown that if these kids are gotten to early enough, and these services are provided for them early in life, they actually do much better later than if they're delayed. So we're very adamant about making sure that all these testing is done on time, and we perform the testing and the screening on all of our patients. And that's another reason we need to see everyone for their well visits, because we certainly don't want to delay these types of treatments, because they are time sensitive, and we provide parents adequate information about autism, resources, where to get their therapy done, and kind of taking them step by step while holding their hands and really helping them to the best of what the latest technology, testing, and therapy is, to provide them information about that.
Right. So what I'm hearing here is that, if a child has a heavy autism and stuff and might need some treatment, that might be done out there with some very specific specialists. But, getting all the basic information, and more than that, getting basic tests done, that can and is done right in your office as a routine and regular basis to make sure it isn't there, and that it can be helped out at very early stage. Because is it so? Are you saying, or is it true that autism, if let's just say it's not very heavy and it gets detected very, very early, is it a little bit like with cancer, where if it detected early and know, then you can kind of at least slow down the whole thing and diminish it, or not?
Well, they've actually done a lot of research on this, and they showed that the kids who gotten early intervention, they did significantly better and some of them actually caught up to their regular peers when they hit school age, versus a kid that did not, and their treatment was delayed by a year or two. Those kids had to be in special education classes when they reached school. And because of that, we are really into providing our patients this screening for all of our patients, and that is done right in our office, specifically for autism, at 18-month well visit and a 2-year well visit.
Beautiful, beautiful. So early detection in autism like in so many other illnesses, is key, is important. You get your kid prepared. Even if it for some reason is still there when the kid goes to school, but the kid is prepared, almost like if you take physical therapy and for long enough and early enough, you still might be handicapped, not have a leg or whatever it might be while you did it, but you can function and integrate in society much, much better than otherwise.
That's right.
Beautiful. Thank you very much.
Thank you.